Beauty means an outward reflection of how you feel in your heart. So I want my patients to look as good as they feel, or to see the version of themselves. Sometimes I have patients bring a picture of them when they were 20 and they're now in their 60s, and we kind of just look at how we can bring back a few of those things that they had seen in themselves before. So I never try to make them have them look like anyone else, just like the best version of themselves.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Danielle Moser, a nationally certified physician assistant with over 24 years of experience, specializing in injectables and aesthetics. She's built her career on a foundation of compassion, clinical excellence, and a deep commitment to patient-centered care. She's especially proud to be the owner of Facial Artistry and Aesthetics, where she combines medical expertise with an artistic approach to help clients look and feel their best. She's passionate about staying at the forefront of the ever-evolving aesthetics field and continuously seeks out the latest advancements to enhance her practice. So Danielle, welcome and glad to have you here.
Thank you so much for having me, Daniel.
Yeah, so how did you first get interested in medicine? Let's start there.
Well, my introduction to medicine was in 1998 when I completed my PA school training. And my first job was in the emergency department at a very busy Southside hospital here in town. So I was there for my first 4 years, and I always joke that I went from saving lives to making people beautiful. But I was lucky enough to come into the aesthetic world in 2002, right when this industry was taking off. So my practice that I had joined was kind of at the forefront of everything, and we were the first in Arizona for the most part to acquire most things. We were the first to have Botox in our hands, and probably Restylane as well. So it was a very fortunate time to be learning. Back in the day, there was kind of only one laser that did each thing. Now we have 40 that do the exact same thing. So it's kind of an amazing evolution that's taken place over the last 23 to 24 years.
Mm-hmm. So what was it that caused you to transition over to the aesthetic side specifically?
I was married to an emergency physician at the time, and the head of their practice had a spouse that owned a cosmetic dermatology practice,
Mm.
and I was mesmerized by the whole practice at the time. And I was also pregnant with my first of what would end up being 6 children. And she said, "Why don't you pop out that baby and then think about coming over and working with me, and we'll start this wonderful thing together." And it was right at the very beginning. And when I first joined the practice of Dr. Comstock and Dr. Pai at Skin Spectrum here in Tucson, I was the first PA to kind of be in the industry, and that was very exciting. Botox was not yet FDA approved. So at that time, we
Mm.
had kind of the old-fashioned collagen where we would do a little skin test, and the patient would come back 2 weeks later. We would apply some very painful substance called Zyderm and Zyplast, and that would last 3 to 6 months. And then you'd have to kind of rinse and repeat. So there wasn't a whole lot of patient satisfaction with that injectable. But then we got lucky a few months later, and Botox hit the market. And about 6 months after that, we had Restylane come into play, and that was the first hyaluronic acid filler in the United States.
Oh, wow. Okay. So that practice, was that the beginning of facial artistry and aesthetics, or was that a different business and then you started facial artistry later on?
Right, that was an absolutely different practice that's still
Mm.
here in my town and doing very, very well. And I spent the next 14 years in that practice, kind of growing my patient base. And then I moved on to a plastic surgery practice where I spent the next 10 years. And it wasn't until February that a lovely physician approached me and said he was looking to retire, and did I want to consider taking over the practice. He had kind of heard about me over the years, and thought that we had kind of a similar mindset for how we wanted to treat patients and what kind of things we wanted to see in our community. And so he had me come over and take a look at the practice. And 5 weeks later, I was the new owner of Facial Artistry and Aesthetics.
Oh, wow. It's quite a journey.
Yeah, it was a bit of a journey.
Mhm.
Yes. So this is my first time as a practice owner in the 24 years I've been doing this.
Wow, congratulations.
Thank you.
Now, when it comes to your practice, what are some of the most common treatments that your patients and your clients come to you for?
Well, certainly we do a lot of injectables, Botox, fillers, of all different brand names, and then we do a lot of skin pen. And now there's a lot of regenerative medicine that's kind of been introduced into the cosmetic world. We have the platelets, the platelet-derived growth factors that have now become very popular in our industry, and that's kind of the latest and greatest in regenerative medicine. So we can apply those into any open micro channel that we've created, and we do that with either a skin pen device or a laser that makes little microscopic holes in the skin, and then we can apply that treatment as well. And so that seems extremely popular in the last 5 to 6 months. And then all of the radio frequency devices that kind of lift and tighten the skin have been very popular as well, minimally invasive treatments. And then we do a lot of therapy with we do some nutrition therapy also with vitamins and peptides that we inject, and that has been very popular recently. Also, as everybody's trying to take care of their health, and nutrition has really come to the forefront in our community also now.
Yeah, and I'm really curious because I'm starting to see more of this trend where when it comes to medical spas, in kind of in the day, medical spas are very much like you mentioned, is all about Botox and the injectables and the fillers and all that, maybe some laser treatments. But now it seems like there's more and more shifting over into the regenerative wellness side, the wellness side, like holistic wellness, like nutrition, as you mentioned. What do you think it is that's fueling that change?
Well, I think we've realized that in order to have a lot of success with our injectables, we need to treat the skin from the outside in. And that starts with nutrition and gut health, because we see a lot of the result of that on the surface of the skin. So, diets that are very high in sugar end up leading to glycosylation, which causes wrinkles and premature aging. So, we talk to our patients about anti-inflammatory diets and their gut health, other things that will contribute to how the surface of the skin looks. And that leads us to um, a lot of discussion into nutrition and what things might help us out with the skin surface. And that's some of the devices also then cater to the skin surface now as well.
Okay. I want to go back to the regenerative medicine side because I think that's something that's really important. I think most people might have heard about regenerative medicine, but I think most have not heard about it. So, would you be able to give just like a fifth grader explanation on what is regenerative medicine and how it can really help people?
So regenerative medicine is basically something that is going to work at the building block level, the atomic level, and the cellular level to help our cells to recover more quickly and to help stop the aging process just a bit. And so kind of in the broader sense, this is something that we might put into a wound as the wound is trying to heal, to help the wound to heal. So orthopedic surgeons use some of these same devices to put into a knee replacement or a hip replacement in surgery so that that area might recover more quickly. I hear that emergency rooms, trauma centers are now using these applications in gunshot wounds to help the area to heal more quickly. So basically, they help the skin to recover. And so now they're being applied in the cosmetic world, of course, because we'd like faster recovery and cellular regeneration.
Okay, so regenerative medicine in the aesthetics world, if I heard you correctly, it's really kind of two main benefits. One is it speeds up recovery, and number two, it's I guess a little bit more of a natural treatment. Like it helps you to for your own body to regenerate itself. Would you say that's
Exactly.
accurate? Okay.
That's a great explanation. And so basically in our field, we put that on after a treatment that has created some trauma to the skin surface, and it helps the skin to recover more quickly and also to heal itself and to moderate the aging process.
Okay. So when it comes to these regenerative medicine, I hear there's different types. There's the one that you can pull out from your own blood and then you spin it. And then I hear that there's other ones that's more animal derived. I heard that salmon sperm is kind of like the popular one and that's starting to pick up some steam. So in your opinion, like are those two completely different types of treatments, or is it kind of like one or the other?
Yes, and so those things are all on the market right now. And then the latest and greatest is the third form of that, and now is a lab-derived version of all of those. So it doesn't come from the salmon, it doesn't come from a human cell line. It has been modified in the lab essentially. And
Mm,
so we lay that on the skin. So I love it because we don't have to draw the blood, spin the blood down, and go through that whole process. And these new platelets are probably about 300 times the concentration they're showing as, drawing it out of, say, our 53-year-old cellular level. So I think it's actually pushing the field forward quite a bit,
mm.
the newer platelet-derived growth factors.
Okay, so these ones that's created in a lab is they're more potent. They pack more of a punch, and I would assume that as you get older, your blood becomes not as, I'll use the word potent. So you may not want to have like take your own blood out, spin it, and then put it back into yourself. So this one could just be a good alternative for that.
Exactly. So obviously, if we were doing that, taking your own blood out, spinning it down in a 20-year-old, it would be very different than a 65-year-old,
Mhm. Okay,
the results.
so
Mhm.
then I'm sure you get people asking you about this. They say that, hey, like, especially if they're older, like, hey, can I just get my son or my daughter's blood and then spin that and put that into me so I get younger blood?
Yes, I mean that is basically this is kind of leveling the playing ground now because
Mm,
it's kind of like the lab grown diamonds. This is the
mhm,
lab grown platelets,
mm,
and so it's kind of available to all of us at say the newborn stage in terms of our cellular regeneration. So it's kind of the best of all worlds.
got it. Okay, and I want to dive a little bit into the wellness side because you mentioned nutrition, you mentioned peptides, which I want to get a little bit deeper into. But I think when most people think of, again, medical spa, I don't think nutrition is the first thing that jumps into their mind as far as services that they offer, or even peptides. So could you talk a little bit more about the importance of nutrition? Because I think most people think that, oh, okay, yeah, I know I have to eat better, but what does that have to do with my skin or with my aesthetics or with my looks? Could you talk a little bit more about that?
Yes, we really see the results of what we eat on the surface of the skin. So if a patient comes in and they're having problems with breakout, a lot of acne, I know that there's a lot of inflammation going on in their body. And an inflammatory diet is usually one that's very high in carbohydrates, high in sugar, potentially high in alcohol, which converts to sugar. And so I talked to the patient a little bit about an anti-inflammatory diet, being sure that we have something that's very high in protein, lowering carbohydrates, a lot of water to help flush the system. And we talk about how to get down inflammation in the body. We usually talk about fish oils, vitamin B12 injections, and other peptides that help calm inflammation in the body. And many studies have shown that if somebody has high cholesterol or high triglycerides, and they take oral EPA, DHA, which are fish oils, omega-3, omega-6 fatty acids, that you can actually decrease your cholesterol and triglycerides simply with these oral supplements as
Mm.
well.
Okay, interesting to know. So, when it comes to nutrition, you kind of mentioned a couple of things in there. Are there any surprising ones that people wouldn't really think about? You mentioned, like, as far as the carbs, like lowering sugar, lowering alcohol, but are there any foods? Because I think there's a lot of misinformation out there. People think, oh, I'm eating really healthy, but in reality, it's not really helping them. Are there any ones that you can kind of think of off the top of your head that's like people think it's healthy, but in reality, it's not?
Yes, and things that are, considered dietary or low in sugar are not necessarily any better because they're still carbohydrate based and they still convert to sugar. So a multi-grain bread is probably better for you than a white bread would be, but it still has that same conversion at the end of the day into carbohydrate, which is inflammatory. So, and things that are labeled as a dietary food diet or low in sugar, not necessarily any better for you because the conversion still happens into carbohydrate and breaks down the body the same way. So, and then also things like chocolate that people consider maybe bad for your skin
Mhm.
are just bothersome to some people and in high quality quantity. So it's not necessarily any worse to be eating a piece of chocolate from time to time as any other form of sugar.
Okay. So since you're mentioning adding in more protein sources, trying to remove the carb sources, I'm sure you must have some great conversations with patients that are vegan or vegetarians in this
I
case.
know that's a very difficult one also. And
Mhm.
so they're pretty good these days at finding adept sources of protein. So we talk about alternative sources. And then many people have different sensitivities to gluten, soy, and other things. And so they have to be very careful because that will manifest on the skin surface as well. So sometimes we'll do something called an elimination diet where we try to figure out what's triggering the skin surface to be more irritated. I mean, I had one patient, a younger person, we couldn't figure out what was causing her breakouts forever. We had gone through a full elimination diet. And I talked to her then about how much water she was intaking. And it turned out that she only drank coconut water.
Huh.
So that was her only form of water. And once we stopped the coconut water, she
Mhm.
stopped having problems. So she had a sensitivity to coconut. And we didn't figure it out until we had gone 90 rounds of eliminating everything else in her diet.
Interesting.
And many people are sensitive to dairy and nuts as well. And that causes, we generally think of nuts as being anti-inflammatory, but some people have a very high sensitivity to that. So we'll often put that in our little elimination sequence to see if their skin does
Mhm.
better after that.
Okay, so it really is going to be situational on the individual because, like, hey, nuts are good for you. This is good for you. This is good for you. But for certain people, they're just not going to react well to it. So they need to remove it.
Exactly. So that's why we just kind of individualize it a bit, except for some of those peptide injections that are pretty much good for everyone in terms of boosting their energy level and helping with inflammation in the body.
Okay, and that's the one I want to dive into next was the peptides. So I've heard peptides, the word being kind of thrown around more often. From my understanding, it's actually been around for a while. It just hasn't really been brought into mainstream. But what is a peptide? Like, I've tried to figure out, is it a hormone? Is it a supplement? Like, is it a vitamin? Like, what is a peptide?
Yes, so it is something that we give in addition to a vitamin. It is another form of supplementation.
Mhm.
Yes, and so it can be injected, it can be ingested, or it can be given through IVs. And we don't do the IV treatment, so we just give it as an injectable form. Some people choose to take it as an oral supplement, but IV and IM intramuscular delivery just happens a lot faster, but it has
Mhm.
to be repeated more often. So our patients come in weekly to have their vitamin, which is the B12, and
Okay. So with the peptides, is there a certain scenario, I guess, or are there symptoms that people would feel before they're like, hey, I should get peptides? Or is it more of just like um, I'm feeling pretty good, but I want to be at my optimal level. So peptides is going to help me get to that optimal level.
some people do actually just want to be at their optimal level. They've just started exercising, they've incorporated a better nutrition plan, and they want to be at their optimal health. And so we'll incorporate some of these injections as well. And some people just come to us and say they've been dragging for a while. What else can they try? And we add one of these things at a time. We usually don't do them all at once just to see how they respond and how they start to feel. And most people's energy level picks up, and then their sleep gets a little better also as a result at the end of the day.
Okay, good to know. Now, with all these treatments, I'm sure you must hear a lot of misconceptions or myths about these treatments. What would you say are some of the common ones that you hear most often?
In terms of the peptides or in terms
Um,
of,
yeah,
we
just any of the
mostly get
treatment.
some of
Mhm.
the, yeah, there's a lot of buzz these days about fillers, and that's kind of something that we've dealt with as a community in recent months, as there's something called filler fatigue that has kind of hit the internet now, where they're saying that the face might be overfilled, and we start to get some puffy kind of Pillsbury dough looking faces going around town. And some people have been having injections for 23 years, and not always by an injector that knows exactly where that filler is being displaced. And so basically, it's important to have somebody who knows their anatomy very well so that there's excellent placement of the filler and not just watching for trends, but actually watching, observing their patient's muscle movements and the aging process and their lifestyle to determine how much filler should be placed and what type of filler is used is very important. So some people now are starting to say they're afraid of having the filler because they don't want to have a certain look. And I'm saying, and most people that are very skilled injectors in our industry say that as long as you have a great injector who has excellent experience, you probably don't have anything to worry about because they'll assess you on an individual basis and determine exactly what's best for you to just give you kind of a more well-rested appearance.
Okay. And I want to switch tracks a little bit here. I want to talk a little more about your practice and really the strength of the team that you've built there. Because to have a successful practice, it's not easy, and it really comes down to the team members you have there. So you talk a little bit more about your team members and how that's really helped with the practice.
Thanks. Yeah, we took off in February on February 1st, and we really got off to a great start. And I really think it has to do with our team members. We're very small. There's just five of us total, and one of those people is our bookkeeper, kind of at large, who also does a little bit of management for us and kind of helps with a lot of things. And she's been a friend of mine for over 20 years, so she's very helpful in kicking in and doing what's needed. But our team here tries to make a very seamless experience for all of our patients from the moment that they call. They're very educated. They're able to answer all of the questions about our practice. And we make all of our decisions together about any new device that we might be bringing on or any special we might be presenting to the community. But our motto here at Facial Artistry is we're building confidence and community one face at a time. So we're very careful to pay attention to the community. So we do a lot of community outreach. We are involved in different fundraisers, and we kind of do it all together. So we kind of have an open phone policy. We text each other at all hours if we come up with a great idea or if we have something we need to bring up. And so we just keep the communication open, and then we do fun things together, dinners, and we already have our holiday plans for just the five of us and our spouses to have a nice dinner together. So we spend a lot of time and a lot of sharing of ideas to try to create something very seamless for our patients.
I think that's really important as far as the patient experience goes as well. When there's harmony within the practice, then the patients are going to feel it. If there's strife within the practice, then patients are also going to feel it as well.
Yes, my door is always open and they can come in at any time, ask me any questions. We have lots of policies in place, but mostly we try to be very flexible with each other and considerate of each other's time and family, and be sure that we have everything we need to move forward and be strong.
That's what sounds like you've put together an amazing team over there.
Very lucky.
Yeah.
Yeah.
Now, Danielle, I'm curious when it comes to, let's say somebody is looking to get some type of aesthetic treatment or some type of wellness treatment done, but they don't know which provider to go to. What would be the most important piece of advice you would give to that person as far as when they go out looking for that experienced right person?
Well, I would say you actually have to interview that person because right now there are so many things out on the internet, on Facebook, Instagram, TikTok. I used to tease that I'm not even sure I have to be good at what I do. I just have to make people believe I am on the internet. And that's absolutely not true. Those of us that have been around for a while, we have constant education. I've already gone to 4 different trainings this year, and I have 2 more planned. And we are constantly learning and growing from people in the community. So you need somebody who hopefully is board certified as a physician assistant, nurse, MD, and they have had many years of experience. They should be able to show you their book of services so you can see their before and after photos. And they should do a full and complete consultation with you before you choose to have treatment. And hopefully they'll give you kind of an overall approach to I like to lay out a 1 year plan for my patients so they see how the year might unfold, and we move very strategically throughout that year to achieve their goals. So hopefully they are looking at the person as a whole. And I also consider their lifestyle. Do I have a patient who's on the tennis court all day, or do they lead a more sophisticated lifestyle? And I have to consider that before I decide on a treatment plan for them as well.
Okay. And are there any red flags that people should keep an eye out for when they are doing this search?
Yeah, things that are on sale all day, every day are not a sale at all. And just because and there's different ways for us to mix these products, there's different ways for us to distribute them into your skin. So hopefully, you're looking for somebody whose ideas match up with yours for what you'd like to see. And it's a red flag if somebody is willing to put a lot of product into you without making you wait to see the results of a smaller amount at first. So I feel like we can avoid some of the problems in the industry by setting multiple appointments for follow-up so that we can move in a stepwise process to achieving the goal, as opposed to trying to get it all over with the very first time the patient comes in to see you.
Okay, good to know. And I'm curious, when it comes to having an artistic eye, how important is that in what you do and how you approach your patient care?
Yeah, I think it's very important to have great scientific knowledge, and then you must have an artistic eye for what you're looking at. So you have to really, the whole time I'm introducing myself and the patient's introducing themselves to me in the initial consult, I'm kind of staring at them and I'm watching how their musculature moves. I'm watching their expression. I'm looking at the skin surface, and I'm talking to them about their lifestyle, and I'm kind of getting a picture in my head of where I'd like to see things going. And then I use the combination of science and art to kind of figure out how I can make them look like the best version of themselves.
Okay, so it is important to have. You need to have both, I guess, both sides of it. You need to have the scientific side and also the artistic side.
Yeah, hopefully everybody that is in this industry knows their anatomy and has an excellent science background and understands the aging process and the aging face on an anatomical level. So basically, we know that as we age, we lose bone, then we lose the overlying muscle and fat, and we have to deal with those changes as they occur also. And we have to talk about replacement of that's how we fill the skin by, or fill the area by looking at what has been lost over time, what volume loss has occurred. So basically, you have to have an overall picture, but you definitely have to look at the patient and their anatomy as well.
Okay. Now, Danielle, throughout your experience, you've been in the industry a long time. I'm sure you must have run across some pretty tough cases. Is there maybe any challenging cases or memorable cases of uh, clients or patients that you've helped? Basically, they ran into some issue, and then how you were able to get them a great outcome in the end.
Yeah, I've had so many tremendous patients throughout the years. I mean, when Sculptra first hit the US market many, many years ago, it was indicated in HIV patients because as their disease progressed, they had a lot of volume loss. And so that product then became cosmetically approved, and we got to see volume filling up the skin, and people were very happy. It turned them, people who had other illnesses started to look a lot healthier. So we did a lot of those treatments that were very fulfilling. But I had one young person, an 18-year-old male, who had had a deformity of his chin come to me right on his 18th birthday. He had been saving, and we had talked before he turned 18, but his family wouldn't let him have the treatment. So he was waiting for his 18th birthday to roll around, and we did 2 syringes of filler in his chin, and we fixed the anatomical deformity that he had, and he got to keep that look for the next 2 years, and he was very happy and very pleased
You
with
know,
that.
I love stories like that because
Yeah.
I think when people think about the aesthetics industry, they think it's just about vanity, it's just about looks. But the most powerful stories that I've heard from providers is someone that had some type of, I wouldn't say deformity, but they had some type of something that made them look not normal. And all they want to do was just feel normal again. And
Yes, and I've seen that a couple of times, and that's very rewarding, of course. And some of my older patients too, they're just mesmerized by some of the small changes we can make, and it makes
mm,
them very happy.
yeah, it's really just about getting the confidence back, making you feel
Right,
like the best version of yourself.
exactly.
Okay. Now, Danielle, what do you think, I guess, where do you think the future of aesthetics is going?
Well, that's a great question. Every year, I'm just blown away by the changes that occur, and I really think these peptides and now we have peptides topically as well that we apply to the surface of the skin as part of the skincare routine, and almost every line is coming out with their version of peptide for the skin. So that's again contributing to that anti-aging process. But I think that we're evolving in terms of how we use and apply fillers, and we are treating many more areas with neurotoxin. We've added the platysma and the platysma bands, which is basically the neck and the jawline, now can receive some tightening with the neurotoxins, and that's been a great advancement. And I think we are going to see more and more indications for that, and we're going to see more competitors come on the market for the different types of neurotoxins and dermal fillers as well.
Okay. And for your practice, facial artistry and aesthetics, what's your vision for your practice?
My vision is to just really grow in the community and be the place that everybody feels like they can have a beautiful, natural, rejuvenating process, and that they can count on my team to guide them through that process. And yeah, I want to grow within this community so that we have something beautiful for Tucson.
Very well said. Now, Danielle, I have one last question for you, but before I ask it, I do want to point your people to your website at facialartistryaesthetics.com. Now, last question is, what does beauty mean to you?
Beauty means an outward reflection of how you feel in your heart. So I want my patients to look as good as they feel, or to see the version of themselves. Sometimes I have patients bring a picture of them when they were 20 and they're now in their 60s. And we kind of just look at how we can bring back a few of those things that they had seen in themselves before. So I never try to make them have them look like anyone else, just like the best version of themselves.
Awesome.
And to me, beauty is just that outward reflection of that feeling.
Well, there you have it. Danielle sharing your expertise. So Danielle, where can people contact you in your practice?
We're at facialartistryaesthetics.com. We're in Tucson, Arizona, so we have our website. And then our phone number is 520-790-1234.
Awesome. Well,
Thank you.
Danielle, this is awesome. Thanks for coming on. It's a pleasure having you here, and a pleasure having you share all your knowledge.
I appreciate it. Thank you very much.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.